Good morning, everyone. So my name is Momen Abukhdeir. I'm the Chief Data and Performance Officer with Baltimore County. I'm their first Chief Data and Performance Officer with Baltimore County. And a little bit about Baltimore County. One is you're in Baltimore County. Two, Baltimore County is unique. It's one of 3 locations in the entire country where you have a county and then a city that's separate. Completely different jurisdictions. St. Louis is the other one, I don't remember the third, but where you have a large jurisdiction and then the city that it surrounds is not a part of it from a political perspective and a governance perspective. So Baltimore County has a government that was created pretty much to handle about a population of about 200 to 300,000 people. In the last 10 to 15 years, we've seen an enormous increase in the population of Baltimore County. It's jumped up to about 860,000 people. And just to put that in perspective, Baltimore City is at 600,000. We're the 3rd largest jurisdiction in the state of Maryland. So Baltimore County has changed a lot in the last 10 to 15 years, and we're trying to catch up. I'm going to talk about BCSTAT. So there was, when the new county executive came, so one is, I actually graduated from UMBC, so this is coming back here feels really, really good. And then our county executive, which I'll talk about in a second, Johnny Olszewski, actually got his PhD here in data-driven, it was in data regarding how to legislate, like proposing legislation, how to use data to do so. So I'm very fortunate to have a county executive who is completely bought into data. And so to have that level of executive buy-in has been great. And when he came into office, pretty much his entire job was to kind of bring data into every conversation. So he wanted to create BCSTAT. Now, some of you may be aware with CitiStat, which is in Baltimore City, which was the first of its kind, which was Martin O'Malley brought that type of governance where he governed the entire city through utilizing data, having departmental meetings and looking at their data and kind of asking questions. I worked as a deputy director in Baltimore City with CitiStat for a few years. And in that role, I worked under different administrations. And in that experience, I saw what worked and didn't work for data in government, and I tried to bring the best of that to Baltimore County. So with that, we created BCSTAT. Now, the ideal concept of BCSTAT or any stat program, because now it's pretty much international at this point. Countries have it, the military is using it, all the local governments are using it for the most part. It's very popular now, and it's pretty much just bringing data into meetings where you have executive leaders making decisions. And how people utilize that, there's some jurisdictions where they'll just present information and it'll be, just a data dump and do with it as you please. There's other places where they'll sit down and talk about it with specific leaders and kind of hold departments accountable. Oh, you said you were supposed to do this many potholes. Okay, you didn't meet your quota, and then there's some back and forth there. But for the most part, I tried to bring to Baltimore County something that was that could be sustainable, because what we saw with other models of this program is that when you got a new executive or a new mayor or whatever the case is, it kind of disappeared. So we tried to find a way to keep this sustainable, but also still provide that value for governance for elected officials. So the 3 ways that we kind of did that. One is the basic focus is to drive collaboration, is to have those meetings and bring the appropriate stakeholders into the loop, and then kind of look at the data and have meaningful conversations. That is a pivot from the traditional model of STAT in the way that previous stats were very heavily departmental focused. So it was one department, we talk about your data and how you're doing, and then that was pretty much the end of it. We transitioned to a more of a collaboration where we call them cross-departmental stats, but again, those are pretty much pretty generic topics: housing, homelessness, education, equity, transportation, public safety. There's a whole list here, and we have those meetings on a quarterly basis where we have the different departments together and we talk about some of the issues there. The 3 things that I'm going to sort of talk about in terms of making, at the end of this presentation, this word BCSTAT will mean something to you, and that's the hope, and how local government utilizes this information and actually governs and has impact on its residents. And the 3 ways that we are trying to do this, one is, again, to this collaboration, which I'll talk about in a second, but also in being able to provide data support to departments. So again, Baltimore County is very, there's a joke in most of the county executives' presentations where he has the slide that says the 1851 rule. I didn't put it in here because I'm not funny. But the idea was that anything that we didn't do when the county became its own jurisdiction in 1851, we don't do anymore. Or we still don't do. So it's this idea that we are, I will say this, there was one department in the entire county that actually had a data team. And the rest of the departments may have had specific individuals that could do some data work, but again, it probably didn't go anything beyond Excel. And so coming to a jurisdiction like that, where data was just not a priority at all, it wasn't even something that was looked at. Really, we only asked for data when we needed to do a grant application, so after the fact. And so to be able to come into that, there was a lot of departments that, one, didn't think they needed to use data, and then two, just didn't know what the benefits of using data was. And so we had a lot of work to do to kind of provide data support and build that within our county government. And with that comes scaling. And how do we get talent into these departments to build up these teams? So I'll talk about those three. So this is what a STAT meeting looks like. This is our first one. It was behavioral health stat. So specifically we focused on the opioid epidemic. And so with that, we look at, and you can see the kind of people that are in the room in terms of the county executives in the middle, all of the deputy administrative officers, the county administrative officers here. We have an opioid coordinator, our health commissioner, our Department of Corrections. On the right, you have the fire chief, the police chief at the time. And so you have like this room, and then you kind of, we'll present some of the stuff that we look at in a second, but there's legitimate questions around, what are we discussing? Where are we having the most overdoses? Who are they impacting? One of the interesting analyses that we did here was looking at, how many times people, and again, not everyone records overdoses, so there are overdoses that go unrecorded, but we looked at every single overdose, and especially repeat individuals who overdose, to see when it became fatal. And so looking at to know, like, it was around like the third time that someone reported an overdose or overdosed and had to call 911 for that. Usually there wasn't a fourth. So that person it became a fatal overdose around that time. So it was just some of the information that we would talk about and look at ways to provide services. One of the other things that we actually talked about in those meetings was looking at specifically, we saw the areas where the most happened, and they were in motels around Pulaski Highway and Route 40. And so it's pretty interesting to be able to then go into those specific locations. Some were receptive, some weren't, but the idea was that we were able to at least put naloxone in most of them, if not all of them. And we did see a slight decrease in those specific locations where we did provide naloxone. Now, whether they're not reporting them or whatever the case may be, those numbers did go down. But that's some of the stuff that we would discuss in that room. The health commissioner would then, provide resources based on those discussions. Some of the other data that we looked at in our behavioral health stat was around our 911 calls for service. We code specific ones that have a behavioral health component, and that a lot of that stems from an incident that occurred, I believe, in Baltimore City around '83, where there was a shooting of an individual who was having kind of a behavioral health issue with police. But one of the things that we looked at is any 911 call that comes in for that has any type of behavioral health related component, we then now looked at all that data, identified where it is, and then actually began to enhance and expand our mobile crisis team that goes out with a police officer and associated social work to be able to help manage those types of situations. So we would have those conversations, realize the areas where we need to focus, and then in those specific precincts, we would then provide add additional resources for social workers and individuals that could be able to kind of handle those situations appropriately. This is neighborhood stat. It's another, this is almost a catch-all, but we talk about everything in this. We talk about trash, we talk about code enforcement, we talk about any sidewalks, any type of issue. It's just another picture of, in a different space, but same concept. You have the head of code enforcement, you have our housing department, you have various different stakeholders here in the county executive. So some of the things that we talk about, again, with code enforcement, and just to give you a general sense, one of the big things was that a lot of constituents used to complain about the fact that, there's issues all around us, and we have to call about it for it to get fixed. And so we try to pivot to a more proactive enforcement model, and in doing so, we have those conversations. We see the areas where we have a lot of complaints, and we focused on putting together sweep teams in those specific spaces. And you can see now from the dark blue that obviously as we funded that sweep team, we see a lot more proactive enforcement. We've actually seen a significant decrease in the number of complaints that come in for code enforcement.
Sorry, are you talking about residential codes?
Yes, like high grass and weeds, trash cans without lids. This also can include business-related issues like inappropriate signage or whatever the case may be as well. So some of the other things we talked about, so we actually had a resident in Essex come up to us with a paper list that he wrote of every property he assumed was vacant in his neighborhood. And he wanted us to kind of focus our efforts at those specific locations. And again, that was him just walking around his neighborhood, taking a list, and we realized that, well, one is we don't have a vacant registry anywhere. We don't have a list of vacant properties anywhere in Baltimore County. It doesn't exist. And so what we did is we started to analyze different data sets, whether it was areas that had zero water consumption. We looked at buildings that had no BGE. We looked at specific areas that had a lot of code violations that would turn into liens on properties. We looked at areas that were on tax sale. And so we put all that data together to try to predict areas that predict vacants. And then we sent out our code enforcement inspectors to kind of validate, are these actually vacant based on a methodology that they created. It actually wasn't that successful. It was about 50% accurate in terms of the properties that were identified. But what that allowed us to do is to at least have 50% of that list, which was about, I would say about maybe 80 to 100 of our random sample that we went out to do. Those amounts started the foundation of a vacant registry list. And actually, we began a housing work group based on that information, and we actually just passed legislation to have a vacant registry for the first time in Baltimore County. Some of the other topics we talk about in our STAT meetings and how we use data, this is, I believe, so Baltimore County just got its first electric vehicles. We have 3 parking enforcement vehicles. We're really excited about that. And right before getting them, one of the things that we were asked to do, because the county executive had an executive order that any vehicle that was that had it was a vehicle, not a piece of equipment like a trash truck or anything along those lines, that be electric if possible. So when he made that executive order, they were wondering, okay, well, we can buy these electric vehicles. We don't have the electric charging infrastructure for them. So the idea that we started looking at all the GPS locations of all of our county fleet to see where they stayed overnight to identify the best areas to have charging infrastructure. This is something that came out in one of our senior stats, which is focused, again, Baltimore County is unique in, well, I don't want to say unique, but it is a jurisdiction, it probably has the largest percentage of 65 plus individuals in the state as a jurisdiction. From a percentage of this population is about 35%. So one of the big things that we've been focusing on is our seniors and especially around like digital connectivity, but also just overall health. And one of the things that we were looking at was the 911 calls where we have the most individuals calling for falls, right? And a lot of this happens at senior living facilities and assisted living facilities. So those big purple situations, some of them are big retirement home complexes and whatnot. But one of the interesting things that we did notice too in looking at this data was that we identified a lot of illegal assisted living facilities that weren't registered, that were, under the table of the, people can't afford to send their elders to maybe a more traditional senior living facility, and so they were finding these unofficial ones that were much cheaper, and again, a lot of these they're not licensed, so there's no compliance checks. There's not a lot of different hazards, and some of the ways that we discover them is when, for example, the police department responds to a fire and sees a bunch of seniors living in a specific building, and they're like, "Why are you all here?" So that's how they've been found in the past. This actually allowed us to identify 3 to 4 that existed that were unlicensed. USTAT, we talked about areas where we have, and again, these are just different of the cross-departmental meetings that we had, but for the USTAT specifically, we wanted to talk about areas where there was low access to food, specifically areas that didn't accept WIC. So we were looking at where we had specific populations of people in need and especially young people, and then identifying gaps in areas where there wasn't a WIC authorized sort of grocery. And we identified a couple of these areas just to, and we actually had some conversations with Lidl, I don't know, this is a very contentious thing, and Aldi to kind of talk about why they weren't accepting WIC, and one of the responses was that the process to apply was so rigorous and it's actually changed over the last year or so. So we're hoping that, that they will, or at least we can identify another possible partner to kind of accept it in that area. So we also have a few departmental stats for our public safety departments. So one of them is correction stat. We have police stat and fire stat, but with the correction stat, this is kind of a testament to how we've been pivoting towards outcome-based budgeting and how we're allowing sort of outcomes and data to inform whatever fundings enhancements that we provide, that our county executive provides. This is just our contraband, I think they're called, interdictions, I think is what it's called. But you could see that they wanted a canine unit. We gave them one, and it worked. And just in terms of what we were able to capture, a lot of that is also mail, right? So before there was no mechanism to review mail in a way to capture it that frequently. Now, the dog sniffs it, we send it right back. Domestic violence. So we also in our police stat talked about areas where we had hotspots in 911 calls related to domestic violence. So the reason why behavioral health and domestic violence are on here was because about 2 years ago, we hit a record in homicides. It was 49 homicides, which is the most for Baltimore County. And of that, 50% had either behavioral health or domestic violence connection. And so we began to focus on those two specific things. But here, what this actually turned into was that we actually partnered with the libraries that are in those areas to put specific people, domestic violence coordinators in those libraries to be able to provide service, and also partner with the police department in that space. So data support, I talked about, so that's the stat model that I just spoke about, and if a new county executive comes in, a new mayor, they may not want to use their meetings, they may not want to govern in this way. And so one of the ways that one of the biggest gaps that I felt like used to happen back in Baltimore City and in some jurisdictions is that usually the data team and the stat team would focus specifically on preparing for the meetings with the executives. And their departments still were left to kind of figure out their own analysis and whatnot. So what we tried to do is take a section of our team just to provide basic data support to those departments. Anything you need, let us know, we'll help. And the majority of our team, we have 1 or 2 data scientists, and then we have the majority of them are either GIS or they're just analysts that utilize Power BI, whatever the case may be. But we provide those services to those different departments. So they, sometimes they'll request, the request will come in different ways, and then we kind of look it over, see who the best fit is to help, and then help. So one of the things, the 2 examples, one of them is that our code enforcement team had no mechanism for tracking sweeps that didn't result in, inspections that didn't result in violations. So, they would go out, they'd check 50 houses, they'd find 3 violations in that neighborhood, and in essence, the data would only show 3 violations. It wouldn't show all the work that they did where they identified properties that had no issues. And so we created, actually, Mike Haxel up there, our senior analyst, was the one that created this tool, and he pretty much, we created a mechanism for them to sort of take an area and pretty much identify that they've inspected that entire area and be able to capture that information for them. So they're very happy about that. We also created a water quality dashboard for our health department that allows that they do their testing for E. coli and whatnot, and other bacteria. And they did not really have a mechanism of entering in that information and making it public, so they would just put out PDFs of their lab results that would come back from the state, and so we created that tool. And that is actually public now. This is just another example. So I don't really like going back to COVID, but there were some wins from COVID, and COVID actually, for the most part, is actually what propelled the value of data to Baltimore County in a way that I would say probably would have taken 5 years, instead took a year and a half. And this is just an example of 2 maps. Early on in the pandemic, you could see that The first one was the one on the left is about 2 months prior. There was absolutely no data capacity in our health department to handle this type of problem. In the pandemic, and the county executive, being a data-oriented individual, wanted daily updates on every single type of metric. And so we had to jump in as the data team to kind of handle everything from vaccinations, outbreaks, everything kind of funneled through our shop. This is just an example of where we had our percentage of vaccination based on the population. So obviously, the orange, red are areas where there was the least amount of vaccination out of the total population. And we actually provided that information to them and worked closely with our mobile vaccination unit. And in 2 months, you can see the change. So it was an example for our health department that this is the project that pretty much propelled the utilization of data in our health department. Another example of some of the data support we did, we had, again, during the pandemic, obviously, daycare, childcare was a big thing. And what we did is there was a grant that came to Abilities Network, which is a nonprofit, and they wanted to utilize that grant to stand up childcare facilities in areas that didn't have them. And so we had the list and did the analysis for them to identify the areas that had the largest population of kids under the age of 5, and then also where we had the most facilities, and provided that information so that they can focus on doing the outreach in those specific areas to provide the grant. The other big thing that we did during the pandemic, which actually it did get national attention, was our eviction risk index. One of the things, we knew the eviction moratorium would eventually be lifted, and we received a ton of eviction money to provide services. So we created an eviction risk index that allowed us to identify areas that we wanted to prioritize applications that came in for eviction assistance support from those specific locations. So as applications came in, if you were in one of those areas, you were prioritized on the list. So we took, and we call this American Rescue Plan map. We're actually one of the few jurisdictions to do this, and we actually got to present this in front of the White House because of utilizing this. But pretty much we took all that data that I just talked about. All of that data, we kind of put it together into one map and to identify vulnerability, and a lot of other data sets as well. And we kind of, what occurred is that the federal government came out and said that you can spend your American Rescue Plan dollars only in qualified census tracts. And Baltimore County, because it's changed so much over the last 10 years, those were the only areas identified as vulnerable in Baltimore County. And so we knew that was not the case. We knew that the data was outdated, that definition wasn't true. And so we actually took a lot of the other different data sets, whether it's food insecurity, qualified census tracts, areas of CDC's social vulnerability index, domestic violence hotspots, vulnerable housing hotspots, behavioral health, public safety. We took all that data, kind of put together and created this map, and then sent that to the federal government to say that this is where we're going to spend our American Rescue Plan dollars, and it was approved. So we were able to definitely service a lot more people. And again, this is just kind of identifying that, how kind of we got to that map. And this is just a plug, but I think it's very valuable. When we came to scale data in Baltimore County, we actually unintentionally started a data fellow program. What really happened is we actually put out postings for data analyst positions and whatnot, and the applications were relatively underwhelming. And then we just said, let's just get a fellow, and we just changed the name to a data fellow, and we got amazing applications. And these positions, they start around $45,000, $50,000, $55,000, and we had some, and maybe it's a result of the pandemic and just, people, but there was a lot of individuals that had, graduated, and UMBC, other universities, University of Maryland, and they were looking to kind of begin their career and just weren't getting the opportunities, I guess. And so we started this data fellowship program, and it's actually been our way to scale data to other departments. So a department will come in and say, oh, I want a fellow. They'll pay for it. We'll bring them in, mentor them, and then at that point, after a year, they then get offered full-time employment with a specific agency or whatever the case may be. And we've had about, I want to say it's almost 7 data fellows since the beginning of this program. 6 are all fully employed. Well, 5 are currently employed. One of them actually went on to do bigger and better things in a different jurisdiction, and we're sucks. But the others are all employed here with Baltimore County. Some of them doubled their salaries. They've gotten really good positions and been able to prove themselves. And they're expanding to these other departments and providing that network of individuals. So if anyone's interested in a fellowship, it's on our Baltimore County website. But that's been our way to scale it, because it's really difficult to kind of get, with specifically with county government, the hiring process is awful, with any government pretty much, and to be able to kind of bring in individuals, test them out for a year, train them in the appropriate way with the tools that you have access to, right? If someone comes in, they have access, and they've only used Tableau, but we use Power BI. Not that there's a huge learning curve there, but still, like, you're already getting exposed in that year to the data that we're already utilizing. And then the last section to all this is our transparency section, and pretty much making data available to the public. So this may be controversial in this setting, maybe not, but at the end of the day, we elected, at least in the short term, to present information as dashboards, right? And we get a lot of requests from journalists, data scientists, and whatever the case of, we want to see the raw data. And one of the issues with that, individuals in the past, they would just put in a PIA request, and it would take however long for them to get that information. What we wanted was to make data available to the average citizen, to be able to go in there and get what they're looking for and be able to filter and whatever the case may be. And then if somebody still wants that information, it's available. But one of the things that we also came across was that whenever we tried to publicly put out a dashboard with underlying data, we had to remove so much. So for example, we have, and I'll share some of them, but we have like a crime dashboard, for example. So if we were to allow the underlying data to come out, to be able to be downloadable from that data set, we would have to remove anything involving juveniles. But in the aggregate, you can still find that information because it's not downloadable. But we can talk about that later at the birds of the feather thing, whatever the case may be. But I just wanted to kind of put that out there in the front so that you see that, yeah, most of these dashboards, you cannot download the data from them. They're just interactive in that way. So one of them is our crime dashboard. So it has every list of all of our different crimes and where they're occurring. And you can obviously filter and look at whether or not there's a juvenile offender, it was a crime against person, by zip code, whatever the case may be. We also have a traffic stop dashboard. So one of the things that was identified by our politicians was a disproportionately individuals, people of color were stopped disproportionately in terms of the traffic stop population. You can see over here that, what is that percentage? And again, this screenshot is outdated, but it is updated on the website. 56% of all the individuals that are stopped were African American or Black, and that's not the population for Baltimore County is around 35% to 30, maybe 30%. And again, understanding that there's no such thing as boundaries, right? So obviously people could be driving from other jurisdictions and whatnot, but it was something worth noting, and we actually spent a lot of time in some of our police stats actually analyzing by officer the stops that they had and how they compared to other officers in those precincts. We have a code enforcement dashboard. What this did actually is we have a 311 call center, and our 311 call center would have to go into a system if somebody would call and say they want to check on the status of their code violation, or they called on a neighbor, or they received one, they would want to get some information on it. We created this dashboard, and now our 311 call centers even use the dashboard, but it's real time. You could look up any address, see the violations that they have, and what's the disposition, and this is the way to look it up. I just talked about the water quality dashboard, so we do those testings regularly, and now it's on there, and then the QR codes are actually getting printed to signs at each of these bodies of water so that anybody there can check and see if it has a green, yellow, or red dot. We also have our opioid dashboard, which is updated and shows where we have all of our non-fatal and fatal overdoses. One thing to note here is that obviously overdose data is protected. And so the reason we're able to share this is because it's from the police department, and pretty much, I guess the one thing to note is that obviously there are times that there's overdoses where the police do not respond, right? So we obviously know there's imperfect data, but nonetheless, it still provides some very interesting information. We also have access to other data that comes from the medical examiner's office that is very accurate. It's very outdated, but or it has a huge lag time, but it does allow us to then validate between the two data sets and see. And for the most part, the lines are pretty. We're seeing, and the reason why we chose to have the graph by demographics specifically for Black or African American and white is because we have been seeing this trend in increase in Black or African American individuals overdosing with opioids. Yes.
Very nice looking.
Thank you. I didn't make any of them. So internal, though I will say that the water quality dashboard, that's Esri, so GIS based, but the rest of them are Power BI. This is our internal affairs dashboard. So we wanted to be, we're actually one of the few jurisdictions that do this. We actually got calls from a lot of jurisdictions when we put this out, but this was pretty much complaints against police officers and also uses of force. And the idea was, to put it out there and allow people to take what they may from this information. Basically the gender of the individuals that are having that use of force applied, the complaints against specific officers, their demographics, and also just generally, age and gender. We also have a restaurant closure dashboard that's coming out soon, probably in the next week, which identifies all of the different restaurants in Baltimore County that have been closed or anything within the last year. And then budget, again, financial transparency. We have an open budget platform where we show where we spend our money and how we budget our money. So transparency has been a big thing. This community map says I have 12 minutes. I'll talk about it really briefly. So one of the big projects that we're working on, and this could also be a discussion for the birds of a feather discussion during lunch, but we have all this access to great data. As a local jurisdiction, we get a lot of data that we cannot share publicly, right? But unless it's aggregated at a level, and usually it needs to be aggregated to a point where it's at a zip code level, which is pretty much, in my opinion, useless. But we have been trying to mesh a lot of data together so that we can share it and aggregate it at the census tract level to provide value to anyone who's looking, because we get a lot of questions from our nonprofit NGOs, a lot of journalists, researchers, whatever the case may be, that are looking for information to better understand Baltimore County. And one of the things that we're hoping to create, and we're about 50% there with the goal of going out, having it created by September, but is the social determinants of health map based on those specific acknowledged principles that impact quality of life, social, economic, education, healthcare, and neighborhood. Utilizing that, finding specific measures. We have data from BCPS, from CCBC, from our educational partners, but also from our health providers and all of this, and obviously our departments too with crime and whatnot, and social services, to be able to put together a map with various different layers that will allow people to pick any specific thing. Obviously, a lot of it will also be census data, but to be able to pick and be able to do their own interactive analysis on identifying where there's specific vulnerabilities in Baltimore County. So we've been working on that, and again, you'd be able to filter it. But this is what we're hoping to get to, is to get to the point where that same vulnerability map that we created for the American Rescue Plan can be available to the public, and obviously identifying where we have our assets. Thank you.
Thank you for your talk. I had a question about the vaccinations. So, because early on in the pandemic, and I don't know if this is still the case now, but the authorization was given to two-shot vaccines and then the one-shot Johnson & Johnson. And, I used to work at NIH, and one of the researchers there used to live in, or not to live, but he worked in Honduras and Guatemala. And one of the things that they were looking at is, if we give them one dose of this vaccine, will it act like, and there's no difference in outcomes, can we get a higher sort of rate of vaccination, because they were normally giving 2 doses. Did you find any differences, or did you look at differences between Johnson & Johnson and the Pfizer, Moderna in terms of like how many people were actually getting fully vaccinated? Because with the 2-shot vaccine, you might have had follow-up issues.
So that's a great question. So I don't know off the top of my head. We had the data. I just don't know the answer off the top of my head about how many in Baltimore County received one or the other. The one thing that was pretty alarming was the percentage of individuals who didn't get their second vaccine. So one of the things that we did do when we identified that was send out specific mailers to everybody who had not received their second vaccine within a specific allotted amount of period. And it was actually, I know the number of people off the top of my head. I don't know the percentage of everyone vaccinated. It was about 3,000 to 3,500 people that we actually ended up contacting after a certain period of time to get them to do their second vaccine. But I know that doesn't completely answer your question, but yeah.
Okay, no worries. Thank you.
You're welcome. Thank you.
Yeah, thank you for your talk. I loved seeing how you were taking data and just applying it to support community. It's like data in action. It's really great. I can imagine like having all these departments, it being like their own like little data islands. Was there like challenges? Like, I don't know if you were trying to like centralize some things or just pull things together from various departments, but what challenges did you have in any of that?
Yeah, I had different, so Baltimore County is very different than Baltimore City. So my experience in Baltimore City, it was very siloed, where different departments had their own, I would say that the IT team kind of played a support role, but departments for the most part maintained their own data. I know that that's changed now for them as well since the ransom attacks and stuff whatnot. But Baltimore County had a very strong centralized IT department to the point that I don't want to say that it crippled other departments, but it pretty much made it unnecessary for them to have their own data support because the IT team just had control of everything. So when they needed a report to be created, they went to the IT team, the IT department and whatnot. So I didn't really have to worry too much about silos for the majority of the departments. There were the ones that obviously have legal restrictions in terms of sharing information. So police have their certain information, and then also health, obviously, and especially with the COVID pandemic. I'm an attorney by background, so I spent most of my time creating data sharing agreements with those specific departments to make it work. But for the most part, I did not struggle too much being able to pull information because of the strength of our IT department in Baltimore County. So I hope that answers your question.
Thanks.
Hi, good talk. This is excellent work and very important. I'm wondering about the necessity that you mentioned of aggregating the data before making it available for download. Is there some problem with the granularity of the raw data, or is there personal information?
Yes.
And why isn't anonymizing it sufficient?
So it depends on the data sharing agreement we have, right? So some are saying you cannot anonymize, and that's just sufficient. Some of them, specifically with police, allow us to do like center block anonymization with GIS, but for the most part, it is personal identifiable information. So that's one aspect. The other is, again, those sort of regulations. I mean, how do you say this? HIPAA is very restrictive, but you'd be surprised at how many other, like SAMHSA and other federal regulations, like even the Criminal Justice Information System requirements from the FBI and how restrictive those are. They're even more restrictive. So, you could work around, and I don't want to say work around, but you could figure out ways to still be a covered entity under HIPAA, for example, but you do not have those same abilities to do that for the other data sets. So realistically speaking, if we were to abide by the requirements of the data sharing agreements and the federal legislation, and even state legislation in certain times, you'd be getting zip code level data on what's in the census. I mean, realistically, that's how restrictive it's been. I've been spending most of my time trying to figure that out. But the problem is that the data that we do receive, because it has that personal identifying information and we have to kind of keep it closed and shut, has allowed us to do some really great work, like direct outreach to specific individuals who are unemployed, direct outreach to individuals who aren't getting vaccinated and whatnot. So it's kind of a balance. I hope that answers your question.
well enough. Yeah, I'd be curious to talk more during the
Sure.
Birds of a Feather. Thank you.
You're welcome.
Hi. So first off, thank you for the excellent presentation and sharing your insights on how Baltimore County uses data. So my question for you is just like, how does what role does data governance play in STAT, and more specifically, like how do you ensure that the data used in STAT efforts is of high quality?
Yeah, it's a great question, and I'm of the philosophy, which is to get started is better than waiting for that data to be perfect, right? And understanding the limitations, but sometimes understanding that the audience don't know, so they're going to take it as truth sometimes. So it's been a huge struggle. One of the big things with data governance regarding our internal team. So the first thing that we started doing is we kind of created like a Juris database. It's just a database that we have, a SQL server, and so we started to just pull information into it from different sources so that our team can now utilize that information, and in that created a data governance structure for that specific thing. And we're not done yet. We have a long way to go, but it allowed us to get a sense of how important it is to document where everything is coming from and whatnot. So every stat presentation at the bottom of the slide has the source, has all the basic different metadata involved with where we pulled the information, how we got it, and whatnot. And none of the no one's looking at it outside of us, right? But that's kind of how we've been able to do it. And then most of the other data governance has come from the requirements of legislation and data sharing agreements of like, if you're going to get this data, you need to make sure you sign this, place it here, store it here, et cetera.
All right, thank you.
You're welcome. But it is a weakness that we are working on. It's definitely, we're not as advanced as other jurisdictions in that space.
I had another question actually. So, with all the data that you've collected, it seems like what you're doing is like characterizing what the status was at a certain point in time of these various things like vaccination or, at risk for rent and for eviction and all that. Are you currently looking at using any of that to make, projections or predictive analytics so that resources in the future can be better allocated?
Yeah, absolutely. So just where Baltimore County came from, right, this is what we needed to do. And we needed to get everybody, and we still have so much work to do. There are departments that are starting to ask those questions, we had one specifically around the traffic stops where they wanted us to kind of predict the areas that we thought would have the most disproportionate amount of traffic stops. And so we would do some of that analysis. So I would say that, but it's a very small portion of our work just because at this point, we just don't even have the basic capacity to do, basic analysis of data. And we have a very old population, and we also have a very old government. Like the average age of our employees around like 50 to 55. So taking a lot of those individuals and getting them to create their own maps has been kind of my key, and just being able to analyze information has been my focus. But the goal is to get there. We've done it a couple times for certain things and whatnot, but yeah.
Okay, thank you.
You're welcome.
Hey, so my question is more about the future of kind of Baltimore County and how they look at new data sets for new things that are popping up. So you mentioned electric vehicles. Electric vehicle charge stations have different reliability and uptime. Are you guys going to be releasing data sets on where charge stations are, how reliable they are? Cannabis is rolling out, and July 1st is Baltimore County going to release more data sets on that for the public to understand who's...
What was the second one? I'm sorry.
So the second one was like cannabis is rolling out in Maryland. So are you going to be releasing data sets around that? So just these new data sets for these new areas.
Yeah, so we actually, we're tasked to create a dashboard on the different facilities that sell cannabis, and we just found a state one. So they already created it, they manage it, so it kind of functions through that. So we just kind of point people to that tool in terms of that. In terms of charging stations, so pretty much all the charging stations in Baltimore County, none of them are Baltimore County owned, and none of them are Baltimore County installed. We're just starting to install specific stations now in this effort, but the majority of them are partnerships with BGE and whatnot. So we do have some locations that we can identify, but we have not our goal whenever we're getting a new data set, one is there value in making it public? And then two, obviously analyzing it. But I would love to hear, even after this talk, of some possible new data sets that we could put out there, because some of them we have, and we just aren't really looking at them. So
Thank you.
you're welcome.
Thank you so much. Fantastic work. I want to say first that I'm all about open data, and I'm a faculty here, so I work on these kind of things. But I'm going to play devil's advocate. Are you thinking about the potential unintended consequences of sharing this data openly with people? Like maybe people changing the way that they interact with the Baltimore County, the areas that they visit, and
That is one of my biggest issues. Luckily, again, we have an executive who's very bought into this, and so a lot of the data that we do share is publicly available, right? Like if you go through the process of putting in a public information request, you'll get it 6 months to a year later, but you'll get it. It's public information, and so that's the first thing, is that it's not our data. It's publicly available, so we have, I believe we have a moral sort of obligation to kind of put that information out there, make it easy for people to use, especially the average resident. But I deal with so many concerns, about like the restaurant closure dashboard, the pushback that we've experienced, trying to put that out from businesses who are like, I just bought this business, and now you're going to put it out there and say that because the previous owner had it, that Subway has cockroaches, or whatever the case is, right? Like, so we're constantly dealing with that, and at the end of the day, I mean, it just goes back to if it's publicly available or not. Like if someone else, if a reporter can get access to it, it doesn't make sense that the average resident shouldn't be able to get it. And that's kind of where I draw the line. Now, when it's data that is not necessarily publicly available, that's when, we start to have more conversations. But I think a lot of the times, our county executive, and my philosophy as well, is that if someone's going to bring a problem, let's share the problem with them, especially if we're working to try to fix it. Understanding there's going to be negative consequences, understanding that people who weren't aware of the disproportionate impact of traffic stops, for people of color in Baltimore County are now going to be aware of it, right? But we shouldn't necessarily shy away from that. But yes, there's been a lot of my job is managing that.
thank you.
You're welcome. Thank you.
Hi, I have a question about data governance a little more, and silos and how you actually manage. I was wondering if you had any programs for data stewardship implemented into this data governance cloud, and how do you handle the communication between silos and data stewardship?
So, again, we're very early on in the data governance field, so I won't say that because in our model, my role has the stat process. I'm also the chief data officer, which obviously involves data governance, and then involves just basically data literacy in general to every employee. So it's a lot, and getting people to buy into data was the first goal. Now we're pivoting over to data governance. So when I first joined the county about 3.5 years ago, we had just started a data inventory. That was all we had, an Excel spreadsheet, SharePoint, and it was just a document that shared all the different things, and then we started to try to categorize, like, is this really highly sensitive? Is this, can this be shared publicly, and kind of going through that exercise. And then what we did is we identified those data stewards, right? So we identified all the data coordinators. What we found out was just that most of them were admin, right? They were the people that were the executive secretary for the department head, right? So they were not data people. They would be the ones that knew who to talk to get information. So when we needed data, they would go to the engineer in the sewer design group and say, hey, can you share this to us? And then they would get it and then aggregate it all, and I'd get a bunch of Excel spreadsheets, sometimes even PDF reports. So, that was kind of what we're dealing with. So we created this network of, I don't want to call them doers, but they are the doers. Like, they're the ones that, even though they may not have the title of data steward, they are the data steward. They know the most about the information. And we identified those after 3.5 years of working with their data. And now we've created a smaller subset of data coordinators, and we're actually meeting on June 22nd to kind of have one of the first large kind of let's get this project started, because we looked at different possible outside contractors, and it's just very, very expensive to get a contractor to come in and do data governance work for you. So I was pretty much told like, oh, you're an attorney, figure it out. So I'm figuring it out. But once we identified those small group of individuals, they're in direct communication with each other all the time. We're constantly bouncing ideas off each other. So it's almost an informal network of data coordinators that we've kind of created. And it's for two different reasons. I just want to, because there's for the actual data work, and then there's the public budget performance measures. So one of our things is also putting metrics out that are just that any resident could get a better sense of like, what does the Department of Public Works and Transportation do? Okay, well, it's the number of bike miles paved, number of total miles, street miles paved, number of sidewalks, et cetera. Like data like that.
Thank you.
You're welcome. Thank you.
This was obviously a very popular talk. Congratulations.
Yeah, thank you.
So I asked this question as a resident of Baltimore County. You've said repeatedly that the county executive is a big proponent of a sort of a data-driven approach to governance. How much buy-in are you getting from, say, the council or from county staff? Like, is this an uphill battle every day, or is everyone sort of, have people seen the light, or are there small silos of people still resisting? How easy has it been? And it's okay to answer in euphemism.
No, the council have been supportive to this program, right? They fund it every year, so that's not an issue. And they buy into the vision of the executive. And I know in the past there have been various, the council's main power really is they can just cut the budget, right? But they can't add to it. They can't move funds around. And so historically, they just cut. In this county executive, it's a lot more collaborative, and so there really haven't been any cuts in the last few years. So that's one aspect of it. The biggest pushback was employees, right? And a lot of it is and I was actually telling someone in the back room kind of this, that I was dealing with this, but the first thing police department said to me was, you can't have this information. It was just basic crime data. And I was like, why not? And they were like, oh, there's a bunch of legal considerations. We need to get the attorneys involved. And I was like, oh, well, I'm an attorney, so let's talk. And the reality is, I'm not going to say I'm like this, like I'm not a good attorney compared to other data privacy professionals, right? So, but at the end of the day, just them hearing, these are individuals that have worked in their job and have just been saying no and finding reasons to say no their entire career. And so to be able to come in there and at least remove one of those barriers and have those conversations, and then know that I have a 6'7" county executive behind me, has been really huge. I would say that now, and I'm completely making up this number, so it's it's not what we should be doing. But I would say about 90% of departments have kind of bought in and seen the light, and they've seen the value. And we just had a meeting recently. I talked about the fellows. They've been doing great work. Our Department of Economic and Workforce Development actually was about to procure a consultant. We're really bad for consultants, by the way, but they were going to procure them to do like a financial assessment of a specific event. It was the Maryland Lacrosse Championship, and we had a fellow do it, right? Do a ton of research, spend about 2 months, put together a really good cost-benefit analysis from that event. We just had a presentation, our transportation stat, where one of our fellows actually presented. We have the circulator, the loop in Towson, and we were looking at, now it's been almost 2 years, let's do like almost, it wasn't an official feasibility study, but we began to, they came to us and were like, can you just look at what's going on with our circulator? Is it doing the right things? And we actually noticed some pretty interesting things. For example, the majority of our ridership were at areas where there were not MTA stops, right? And so that wasn't what it was intended to do. It was intended to be overlapping with MTA so you could get to different locations, but people are either using MTA or they're using the loop. And then we also found some gaps in access on specific parts of Towson where individuals could not be able to even get to that area without more than 5 minutes of walking. I hope that answers your question.
It does. Thank you very much.
Yeah. I think I'm done.
Moment, everybody.